Okay, so one of these is the femur, and it's important to always know the difference between the femur and the humerus. One's massive and a lot bigger, and it has a similar groove, but this basically gives it away. This is always the humerus because they later on fossa, whereas this doesn't have a hole in it, it has a popliteal side. So let's get rid of that. So the femur, big bone, important to establish, has a head, a neck, a shaft, and a base. This flat bit always shows the popliteal fossa, the base of it. So that's always the posterior aspect. And then on that side you will see the lesser and greater tubercle. So this is the left femur. Important to then talk about some of the muscle attachments and anatomy. The head articulates with the acetabulum, forming the hip joint. And there is a surgical neck with an intratrochanteric line, because there's a greater trochanter, lesser trochanter, and a trochanteric line as well that occurs between the two on the anterior surface. So anteriorly, very briefly, try and keep it in threes. There is the attachment to the gluteus medius, minimus, and then the piriformis on the anterior lateralmost aspect of the greater trochanter, and that's the piriformis that comes across the hip joint. It marks the differential between the superior gluteal artery and the inferior gluteal artery that comes below it. And then as you move across, the iliopsoas has an attachment, that's the main flexor of the hip, on the lesser tubercle. And in between is really the vastus lateralis, on the lateral aspect beneath the greater tubercle, vastus medialis, lesser tubercle, and then the broad attachment of the vastus intermedius. Distally is the medial condyle, lateral condyle. Medial condyle is always a giveaway because it has this adductor tubercle, which is the attachment of the adductor magnus. And then really it's the posterior aspect, so the head, the neck, greater tubercle, lesser tubercle. Already said the lesser tubercle has the iliopsoas attached to it, which is important. As you follow it up, there's a little ridge that you get to bump before the greater tubercle. That's the quadrate tubercle, where the quadratus femoris attaches. And the gluteal tuberosity is this large bit here. It's the lateral aspect, whereas the pectineal line is this, and this linea aspera is the middle roughened bit of the posterior surface that then later distally goes to give a lateral supracondylar ridge and a medial supracondylar ridge or line. So important attachments. Greater tubercle, greater trochanter, has gluteus medius, minimus, and piriformis on the anterior aspect, but on the posterior aspect has the gluteus maximus attaching. And also the muscles at the greater trochanter can have the superior gemelli, obturator internus, inferior gemelli, and then the obturator externus, and that's the go-go ones that form the muscles beneath where the sciatic nerve goes. Centrally here is the pectineus muscle on the pectineal line, and then on the distal aspect, slightly going down, has the medial aspect, which is the vastus medialis, is already on the anterior surface, but has a slight attachment as posterior. Adductor longus, biceps femoris, and then the vastus lateralis as well on the distal. Right at the distal aspect, adductor magnus attaches here on the adductor tubercle. And just proximal to that is the medial head of gastrocnemius, lateral head of gastrocnemius, and just above the lateral head is where the plantaris attaches. Important to know if we're harvesting it